Hello students, I'm audible. Hello. Hello students, I'm audible. Okay, chal. So last class what we discussed, from that if you have any doubt you can ask. Good morning everyone. Yes. If you have any doubt from last class you can ask. Your doubts I'm waiting to. Okay, I'll go a little slow. Now today's load is less or content of teaching is less. Before classes the content it was high, so little fast we need to go. But no problem. Today I'll go slow. Don't worry. Okay. Chal. So female reproductive system. Female reproductive system we are discussing last class. Again I'll start. Primary reproductive organ, secondary reproductive organ, and accessory reproductive organ. Primary reproductive organs are those organs, okay, what it is responsible for gamete formation. Gamete formation it is called. Yes, here one question is there. What is the function of Cowper's gland? Cowper's gland is Bowman's capsule. Sorry, not Bowman's capsule. That's bulbourethral gland. Cowper's gland is also called bulbourethral gland. What is the function of Cowper's gland or bulbourethral gland? It secretes mucus. What it is responsible for the lubrication during coitus. Coitus lubrication it is due to Cowper's gland. Here you come to, okay, primary reproductive gland or the organ in case of human female. Human female, it will be ovary or ovaries, you can say. Ovary, ovaries. Okay, what is secondary reproductive organ? Last class we discussed the fallopian tube, uterus, you can say. And accessory reproductive organ, you can say mammary gland. Mammary gland, it assists in reproduction or it assists in parental care. Brood means parental care, also the parental care it will help. So next we can move now. The next topic is the female anatomy. Female reproductive system anatomy will start from ovary. Ovaries are situated in abdominal cavity. Testes are situated in extra abdominal cavity. Testes in male it is situated in extra abdominal cavity, and in case of female, ovaries are situated in abdominal cavity. Abdominal cavity, they maintain temperature and they are responsible for oocyte formation or egg formation. In testes, sperm formation. Sperm formation in human male requires less temperature than body temperature. 2 to 2.5 degrees Celsius less than body temperature. Mark this line in your brain. 2 to 2.5 degrees less than body temperature. 2 to 2.5 degree less than body temperature. Body temperature in human male is or human is 37 degrees Celsius. Okay, so for spermatogenesis, sperm formation, how much temperature required? 35 degree to 34.5 degree Celsius, and it is maintained, this low temperature is maintained in testes with the help of the scrotum or scrotal sac. Why testes? It is not in abdominal cavity, it is hanging outside body. So it is all due to in order to maintain low temperature in testes. Okay, I think it is clear. Now go to this low temperature concept clear for spermatogenesis, but there is no concept of the low temperature for oogenesis. Now you go to fallopian tube, ovary position done, abdominal cavity. Then ovaries are partially or superficially attached, not completely attached, partially or superficially attached to fallopian tube. Fallopian tube, it is having the three areas. It is having three areas: infundibulum, ampulla, and isthmus. Infundibulum, ampulla, and isthmus. This infundibulum, it is having this finger-like and funnel-shaped structure, and finger-like projection. This funnel-shaped structure and finger-like projections, it helps in catching or collecting egg from ovary. It collects egg from ovary and transport it to the fallopian tube. Okay. When it enters into fallopian tube, egg or female gamete, it waits here in ampulla region. Ampulla word means swollen area. So can you see here that there is a swollen area or a wide area? This wide area is called ampulla. Ampulla, it is present in many organs in our body or many areas in our body. In ear also ampulla present. In mammary gland also ampulla present. In male reproductive system also ampulla term it will be there when you read. So ampulla means wide area. So in this wide area here, egg, it waits for the fertilization. And if fertilization it happens, then this embryo, this tiny structure, it moves in this direction and get implanted to uterine wall. Maybe this side, maybe this side, maybe this side, anywhere in this uterine wall. And pregnancy, it is conceived. We call it implantation, attachment of embryo. Important term, implantation. Attachment of embryo to uterine wall, it is called implantation. Placenta will come to placenta later on. Okay, implantation, implant, just like seed you implant in soil and then it grows. And when you implant seed, roots they develop. So root like structure in uterine wall is called placenta. Root like structure, it is formed and it absorbs nutrients from uterine wall, and that is called placenta. I'll show you the placenta also. Wait for that. So here you come again. So ampulla and then isthmus. Isthmus is this narrow part, but it is embedded in uterus. Uterus now. So uterus is inverted pear-shaped structure. Inverted pear. This inverted pear-shaped structure, okay, upper part is called fundus. This upper part area is called fundus. This area is called body. Fundus, and body. Here you can see this is called fundus. This is called body of uterus. This area is body of uterus. And then this mouth of uterus is called cervix. Mouth of uterus is called cervix. This area is called cervix. Cervix is having two openings. Cervix is having the internal opening, external opening. Can you see this area? Cervix. Cervix is having the two openings, internal opening, external opening. Internal opening is called internal OS. External opening is called external OS. Important. Internal OS, external OS. OS means mouth-like opening. OS means mouth-like opening. Now here, if careful observation if you'll give, you'll see here the foldings. These foldings are called arbor vitae uteri, or simply cervical folds. Cervical folds. These cervical folds, they release cervical mucus. These cervical folds, they release cervical mucus. Easy, everyone? Everyone, any doubt till this? Cervix clear or not? Cervix clear or not? Then this chamber, here you can see this area is called vagina. This part is called female reproductive organ or coitus organ, vagina. Can you say the, okay, what is the function of vagina? What is the function of the cervix? Function of vagina, function of cervix. Who will explain? Uterus only. No. Yes, very good. One answer came. Birth canal. Super. Very good. Not menstrual cycle. Vagina is not for menstrual cycle. Menstrual cycle is the complex cycle. So here the answer it is birth canal. Cervix and vagina. It is responsible for birth of baby. One function, birth canal. Yes. Here baby it will develop and baby it will come out at the time of parturition through birth canal. Baby it will come out through cervix and vagina at the time of parturition. In simple words, we say the delivery. In simple terms, we call it labor. But labor and delivery, instead of that biological term, you are going to use parturition. During parturition, okay, cervix and vagina, okay, it is called birth canal. It helps in birth of baby. Very good. Next question is, okay, what it is externally visible in female is what? What female external genitalia visible, okay, from externally is called. External female genitalia is called. Please everyone, I want your response. Then only your concept it will be clear. One misconception related to female reproductive system that externally visible structure is vagina. Wrong. Externally visible structure is not vagina, not cervix. Not vagina, not cervix. No, no, no. All your answers are wrong. No, vagina is wrong. It is vulva. It is vulva, V-U-L-V-A, or female external genitalia you can say, or you can say the urinogenital sinus, urinogenital sinus. So what externally visible in female is called vulva or urinogenital sinus or vestibule These are the names you can use. Okay, vulva or urinogenital sinus or vestibule. Okay, externally visible structure in female practice system is not vagina. Vagina is a internal tube-like structure, copulatory organ in female. I think this concept clear. Yes. Then next. This part everyone you can note it down. Remember in male, now the comparison, one small comparison. In male we studied that urethra it carries semen as well as sperm. In male urethra it carries semen as well as urine, but in case of female, urethral opening is separate, vaginal opening is separate, and both they open separately in vulva. Okay, so that's why it is called urinogenital sinus. The word sinus means open space. The sinus word means open space. Clear everyone? Okay, very good. Chalo, move next. So here, this vaginal area opening, vaginal orifice it is called. Vaginal orifice. This opening of vagina, tube-like opening of vagina is called vaginal orifice. Orifice means any tube and its opening. Any tube and its opening is called vaginal. Vaginal opening is called vaginal orifice. Vaginal orifice opening is covered with one thin fold of skin. One thin fold of skin called hymen. It is called hymen. So what is hymen? Hymen is a thin fold of skin. It covers partially vaginal orifice. Now my question is, one misconception again mentioned in society, or that is famous in society, that hymen is sign of virginity. So I want to ask, what do you mean by virginity? You all are going to be doctor. In future, you need to counsel all your patients or the people, those who are coming to you. So how you'll counsel, how you'll explain that how hymen is not a sign of virginity. Yes, hymen is not a sign of virginity, but misbelieve in society that hymen is a sign of virginity. So first of all, what do you mean by virginity? Hello everyone, can you answer? Okay. Okay. So answer is the female with no sexual intercourse experience or female with no sexual indulgence is called a virgin. Okay. Virgin and all these concepts we can discuss later on also. Why hymen is considered as the sign of virginity by some people? Actually, during first sexual intercourse, this thin fold of skin hymen, it ruptures sometimes, but not always. Hymen rupture possible. Hello everyone. Hymen rupture possible during horse riding, during active participation in sports, during cycling, during jolt. Jolt means all of a sudden any jerk, or even insertion of vaginal tampon. All these lines, what I said, it is mentioned in NCERT. You can read, you can understand. Again, I'm repeating. Hymen breakdown possible due to horse riding, active participation in sports, or cycling, or jolt. Jolt means all of a sudden any jerk, or insertion of vaginal tampons. Vaginal tampons are just like sanitary pads. Okay, females, they use it to stop vaginal bleeding during menstrual bleeding phase. So many phases are there. Bleeding phase, to stop or to prevent bleeding on garments, tampons are used. So due to tampons also the hymen tearing, hymen rupture possible. So now you come to this. Hymen is not a reliable significant, having any significance related to virginity. So hymen is not related to virginity. It is myth. So we need to understand this. Okay. Then you go to next part of this. Here you can see the layers of uterus. Very important. Layers of uterus. 3 layers are there. Outer one is called perimetrium. Middle one is called myometrium. And the innermost one is called endometrium. So 3 layers you need to understand. 3 layers of uterus you need to understand. Outer one perimetrium. Middle one myometrium. Innermost one endometrium. Again endometrium innermost, then myometrium muscular layer, then perimetrium. Perimetrium, that is your outermost layer. Endometrium provides connection to baby, connection to embryo, connection to baby for development, for placenta formation. Endometrium. Then myometrium, it is the muscle. It helps in parturition, end of pregnancy. End of pregnancy, the contraction of uterus, it leads to propulsion out. It propel out the baby from body, and that's why it is called parturition. Okay. So next is these 3 layers. Clear? 3 layers are endometrium, myometrium, perimetrium. Only these 3 layers are required to understand. Everyone clear? Now we'll go for this is lateral view of the female reproductive system. Now, why it is called urinogenital sinus? Okay, everyone, please focus. This is urinary bladder, and this is urinary opening, urinary urethral opening. This is uterus. This is vagina. This is vaginal orifice, and this is the fallopian tube and ovary. Lateral view. This is lateral section. So urethral opening separate, vaginal opening separate. That's why it is called urinogenital sinus. This whole area is covered with layers of skin called labia minora and labia majora that we'll discuss in main class. Okay. Yes, I can repeat. Which part? Both the areas are separate. Urinary area separate opening, urethral opening. Genital area, reproductive area, separate opening, vaginal opening. So it is called urinogenital sinus. Urinogenital sinus. It is not common, but in male it is common opening. In male it is common opening. Then here it is the sperm formation. Sperm formation, it will be tough for you now. So I'll go directly to the meiosis, mitosis of this part. Meiosis, mitosis, easily you'll understand. Okay. So please here, 3 layers are perimetrium, myometrium, endometrium. Perimetrium, myometrium, endometrium. Perimetrium, myometrium, endometrium. Endometrium, connection to baby, okay, embryo. Myometrium is muscle layer. Perimetrium is protective layer, outermost protective layer. Meaning of sinus is open space. Meaning of sinus, everyone, open space. Open space. Remaining things you leave it in main class we'll discuss. Okay, chalo. Go to sperm formation. Sperm formation starts in testes during puberty. What do you mean by puberty? One word came here to puberty. Puberty means okay, 11 or 12 or 13 years of time period when hormones, mainly FSH, LH, increases in male or female body, and menstrual cycle starts in female, spermatogenesis starts in male. This time period is called puberty. Puberty, it is marked by the hormone surge in male or female body. Hormone surge means the hormonal changes will be there, and that will be visible from external. Visible from external means in male there will be the beard and mustache development. Male like the voice means that low pitch voice. In female, high pitch voice. In female, mammary gland development. In female, the menstrual cycle changes. So all it is related to puberty. Then, yes, here you come to voice. It is cracking just due to your internet problems. Please check your internet. Audible. Chalo. So spermatogonia, it undergoes mitosis. If it is visible to you, spermatogonia undergoes mitosis. Spermatogonias are reserve sperm cells. You can say reserve sperm cells. These reserve sperm cells, they divide by mitosis and they increase their number. So you can see spermatogonia becomes spermatogonia. A and B I'm writing. Means they increase their number. Means it is multiplication phase. It is called multiplication. Simple words, multiplication. After multiplication, they enter into growth. So total 3 phases are there. Multiplication, growth, maturation. Multiplication, growth and maturation. Don't see this small letters. See here, multiplication, growth, maturation. Multiplication, growth, maturation. 3 words are repeated here. Chalo. So again, reserve spermatogonia through mitosis, it increases its number. After increasing number, some of them, they enter into growth phase. Don't see the number of days. They enter into growth phase. Growth phase means small cell become large cell. One tiny cell become large cell. This tiny cell become a large cell. Means here they eat, they store food, and they increase in their size. This is growth. This is not division. Growth phase is not division. Very good. Okay. So nice answers are coming here. So come again here. Spermatogonia A, I'm saying it enters into growth phase and forms primary spermatocyte. After growth, it is called primary spermatocyte. Then I said some of the cells they enter into growth phase. The remaining cells, again, they are reserve cells. Spermatogonia becomes spermatogonia, reserve cells. Just like seed. Okay, you produced, you suppose your farm up, okay, or a farm up produced, suppose 100 kg of paddy, rice. So out of 100 kg of rice, 80 kg you use it for your food purpose. Remaining 20 kg you kept it for next year cultivation. So it is what? Reserve cells, reserve seeds. So this is again what? This is reserve seeds or reserve sperm cells, reserve sperm mother cells or sperm cells, and these are going to be in division. Spermatogonia enters into growth phase and forms primary spermatocyte. You people, you don't need notes. Don't worry about that. PPT, I can't share here on YouTube. How I'll share PPT? It is close to impossible. Okay, I'm trying, but sorry, not possible. PPTs are having a very high volume, that MB capacity. So it can't be said here. One thing. Second, everyone, on screen also, when you are watching these videos, from screen also directly you can mention, you can write your notes. Okay, it is very easy. Just pause the video and write your notes. Okay, so it is not tough. Don't worry. Come here. So again and again, don't ask for notes, not possible. That's why this PPT is again you're asking. Okay, Nagarju, sorry, not possible. That's why I'm saying this. Okay, chalo. Here, primary spermatocyte, large cell, enters into meiosis, and it forms secondary spermatocyte. Secondary spermatocytes again formed a 2 spermatid. Means from here, if you'll see from spermatogonia journey, total 4 spermatids are formed. These are called spermatids, not sperm. These round cells are called spermatids. Round cells are called spermatids, not sperm. Spermatids. These round spermatids, they undergo maturation, one step of maturation, and after that maturation, they are sperm. Sperm and spermatozoa both are same. Sperms and spermatozoas both are same. They are not different. Sperms, you can call it spermatozoa. So spermatid and spermatozoas are different. Spermatids are round. Spermatozoas are small with tail, head, neck, middle piece, tail. So this is real male gamete. This is real one, the male gamete. What it is going to fertilize female gamete. This is the large cell with large amount of cytoplasm. So it is not going to swim. It is not capable of swimming. So it need to be modified, and it is modified in male reproductive system only. And after modification, this is sperm. It swims and it reaches its destination over for fertilization. Okay, so here again summary, not in detail, in shortcut. Which hormone is responsible for the puberty? Here you can see hormone GnRH from your brain, hypothalamus. GnRH hormone from hypothalamus. GnRH full form is gonadotropic releasing hormone. If you want the full form, I can write gonadotropic releasing hormone. Gonadotropic releasing hormone. Then FSH-LH, follicular stimulating hormone based on the female follicles. Okay, LH, luteinizing hormone. Both hormones. Both these hormones ultimately responsible for testosterone formation in male, and the testosterone and these hormones responsible for puberty. And due to these hormones, okay, spermatogenesis in male. Okay, puberty point clear. Means these reserve cells, spermatogonia, they form spermatogonia B and A and B. A, it participates in division, and B, it is reserve cell. A participates in division by first growth phase. It increases in size by eating. Okay, don't see these things, this 2n xy 4c, all this you'll not understand, you'll be confused. Better to neglect that. Detail of that, yes, we'll discuss in detail in class, don't worry. So basics what you can understand online web, that part only I'm teaching. Offline, yes, in detail, everything point to point, full stop, comma also we'll discuss in class, don't worry. Okay, so here spermatogonia, after the increase in its total content, weight, volume, yes, it is called primary spermatocyte. Primary spermatocyte, okay, it divides by meiosis 1, and it forms two cells. They divide again, they form 4 cells. These 4 cells are called spermatids. Spermatids are haploid, and they undergo one again maturation phase called spermiogenesis, and after this maturation they form sperms. In same way oogenesis. But oogenesis, it is complex, and oogenesis, it takes place okay, before puberty. Remember, spermatogenesis, it starts from puberty. Spermatogenesis, it starts from puberty, but oogenesis starts before puberty. Yes, female, when she is in mother's womb, from that time period only oogenesis starts, and it ends during menopause. Oogenesis, ova formation, it starts from pre-embryonic or embryonic stage of female, and it ends this oogenesis, it starts during embryonic development, when female C is in mother's womb in embryonic condition, and when it ends during menopause. Menopause means 45 to 50 years of female's age. We'll discuss all in detail. Oogenesis is little different than spermatogenesis. In spermatogenesis, we discussed here you come. In spermatogenesis, 4 sperms are formed. 4 sperm cells are formed. Okay, one difference. In oogenesis, here you come. In oogenesis, single ova is formed. Single ova or ovum is formed, not 4. Remember this. In oogenesis, one ova is formed. In spermatogenesis, 4 sperms are formed in one set. Oogenesis starts during embryonic development. Spermatogenesis starts during puberty. Okay, this much difference only. Okay, hormones are same, hormones are not different. Okay, spermatogenesis. Here you come to sperm structure. Sperm structure, this is called head, this is called neck, this is called middle piece, this is called tail. Okay, head, neck, middle piece, tail. Head area, it contains here the acrosomal cap. Acrosomal cap means it is nothing but the enzymes for fertilization. It is enzymes for fertilization. It contains enzymes for fertilization. It contains enzymes for fertilization. Then this is nucleus. This part is nucleus. Nucleus is the genetic material, and it is the nucleus is haploid. Nucleus is nothing but the genetic material and haploid. This is centriole. Centriole is a tiny structure related to cell division. So when this sperm, it will fertilize ovum, at the time cell division in zygote, it will be done by this centriole. Okay, so again this is called middle piece. Middle piece contains mitochondria. This ring-like or spirally coiled area is the mitochondria. And then tail. Tail is responsible for movement of sperm. Okay, swimming of sperm. Here it finished. Sperm structure basic done. This is ovary. In ovary you can see millions of follicles they are developing. Millions of follicles. Out of millions of follicles, every menstrual cycle, one follicle it ovulates. One follicle, single follicle, it ovulates, and that follicle it waits for fertilization. If fertilization happens, then it leads to embryo formation. Okay, so in detail of menstrual cycle in main class, here it is not possible, and you'll not understand without the hormones. Hormones we need to discuss in detail, so that in class. Okay, so here you come. How twins are formed? What is the theory for, or what is the understanding about how twins are formed, that we are going to discuss. Okay, so how monozygotic twins, how dizygotic twins is common question, common doubt of maximum students. Okay, so everyone, please, how twins are formed, we are going to discuss here. Everyone, gametes. If single sperm, single ova, then it is the normal zygote, and it is going to be normal one single human baby. Okay, single sperm, single ova. And if it is, suppose in same ovary or in same menstrual cycle, 2 ovas are released. Everyone, 2 ovas are released, and they are fertilized with 2 different sperm. When they are fertilized with 2 different sperm, they'll form 2 different embryo. 2 different embryo they'll implant in 2 different areas of uterus, and they'll form the 2 babies. They are called twins, non-identical twins or dizygotic twins. Non-identical. Why I'm saying non-identical? Because the genetic material will not be exactly same. Okay, it will be called fraternal twins. It is also called fraternal twins. Two different sperm, two different ova. Okay, and they may be male male, they may be male female, they may be male male possible, male female possible, female female possible, anything possible. Okay, means combination, this combination possible, this combination possible, this combination possible. Now you go to everyone, this is called non-identical twins or dizygotic twins. This is dizygotic twins. Okay, dizygotic means two zygotes are formed. Okay, non-identical because the genetic material not matching. Now you come here, everyone. Here your attention required. Single ova, single sperm, single ova, single sperm. Fertilization done. Haploid is zygote. This cell is, this structure is zygote. Suppose zygote dividing for embryo formation, for body formation, it is dividing. And while it is dividing, suppose it is split into two embryonic cells, now they separated, and now these two separated cells, they'll behave like embryo. Exactly, they are cells of embryo, but now they'll behave like separate embryo, and they'll form two babies, and these two babies are going to be identical because their genetic material is same. So they are called identical twins. They are called monozygotic twins or identical twins. Monozygotic twins or identical twins. You need to understand this. Here you can see these are dizygotic twins. Means these two brothers and sisters, they are formed from not same ova, two different sperm. So yes, they are looking close, but they are not same. They are non-identical fraternal twins. Easy, everyone? Okay, then here you come to, here it is what? Identical twin. Here I said male female, female female, male male, all possible. And here same gender it will be, means it will be male male or female female. Okay, not male female, two different gender, not possible. You got my point, I think? Very good. Now you come here. This is what identical twins. Identical twins. More examples. Here you can see two babies, okay, but attached. In this condition, when these embryonic cells, they are separating, when embryonic cells, they are under separation. Suppose during separation they fail to separate, embryonic mass, embryonic bunch of cells, they're separating, and they fail to separate. It is called conjoined twins. Okay, when it is separated completely, it will be two twins, two separate body. When suppose it failed to separate during development, you can see here, so it will be called conjoined twins, or yes, it is identical twin only. Survival chances very rare, very poor. Here you can see two stomach, single intestine, again two large intestine, single small intestine, two stomach, means some of the area of body it is single. It is called conjoined twins. Here it is not conjoined, but yes, identical twin. Again, example of identical twin. Okay, yes, here you come to again conjoined twins. Conjoined twins after what? When part of body separated but not completely separated, so yes, still attached, it is called the conjoined twin. Okay, failed to separate. Here you can see the conjoined twin, failed to separate. Okay, and it is the steps of the embryonic development. Okay, here the ova, it will come here, it will fertilize, and it will be ready for implantation, ready for attachment. And when it is fully developed, then under microscope, here you can see the embryos. This is the 8 to 16 cell embryo. Suppose here it is the more and more number of embryos developed, and then it will be the developing embryo, and that will form baby and ready for parturition delivery. Here you can see the tiny embryo in uterus in lateral section. Here the grown embryo. This is the 3 weeks embryo. This is 5th week embryo. Okay, and it is suppose fully formed embryo, fully formed. I'm saying 2 months, and then it is ready for the parturition. Here you can see total development. Leave it. This is not required. This is done. Baby formed. Okay, and delivered. So if you have any doubt, you can ask your doubts, please. Your doubts, please. Yes, chances of the 3 progenies and even the 16 highest recorded. 16 babies in single pregnancy. Yes, it is recorded. Okay, in main class we'll discuss more about that. Okay, highest of 16 babies to a single mother, it is reported. 3, 4, 5 also, that is common. Okay, means twins we say, triplets, quadruplets, pentaplets, all possible. Question is, conjoined twins can be separated? Yes, conjoined twins can be separated if their vital organs are not attached. Vital organ is brain not attached. Okay, heart not attached, kidney not attached. Okay, even kidneys are also attached, we can separate. But separation, it all depends on the what organ it is attached. Yes, next. So Zolo, who is this Zolo? Zolo, okay, you are late in class. Already I explained about what is identical twins. Identical twins, I think you are not listening to lecture. Question is again here to Swaroop Reddy. Sir, why do ovum divides into identical twins? First of all, ovum never divides into identical twins. Embryonic cells, ovum, it forms the zygote after fertilization. Zygote divides into multiple cells for body formation, and due to any reason, suppose it gets separated. Due to any reason, cells are separated. Reasons may be many things. Maybe any chemical, maybe any radiation, anything. Multiple things are there. One more question, sir. What happens when baby born in 7th month? So answer is, if baby born in 7th month, it is called a premature delivery. Premature delivery risk it is there. Means baby he or she will survive or not. Chances are less. But now medical science it is advanced. So for that only you people are trained. You'll be doctor and you are going to save that life. Okay. So next part we are going to discuss is how many months conjoined twins can survive. All depends on what is the condition of conjoined twin. Neetu, you asked that how many months that conjoined twins can survive. All depends on what is the condition of conjoined twin. Okay, how much they are attached. Okay, what is their physiological condition? What is their anatomical setup? So you can't say how many months he or she or that pair can survive. So simple answer is according to their anatomical setup. Now our next topic is human health and disease. So to understand human health and disease chapter, first I want to ask, what do you mean by health? What do you mean by health? Anyone? What is the meaning of health? Yes, FSH means follicle stimulating hormone. Well-being. Physical state of mindness. No. Being strong. No. Elephant is very strong. Means you are weak and you are not healthy. As compared to elephant, you are weak, so you are not healthy. No, no, no. Being fit and strong. No. Everyone is fit and strong with certain ratio, certain aspects. Okay. So what do you mean by health? What do you mean by health? Health, according to WHO, World Health Organization, according to WHO, health is defined as it is a complete state of well-being with respect to physical, mental, behavioral, and social well-being. with respect to physical, mental, social, behavioral. Physically, you must be fit. Mentally, you must be fit. Emotionally, socially, you must be fit. Then only it is called, yes, you are healthy. Mainly physically, mentally, behaviorally. Physically, mentally, behaviorally. Okay, when we'll discuss about reproductive health. So yes, reproductive word we need to add here. So reproductively also healthy. So human health and disease chapter, first point it comes to again health. Health we discussed. What do you mean by now disease and disorder? Can you explain disease and disorder? Anyone? Disease and disorder. Disease and disorder. Anyone? Disease and disorder. Disease is something which can be cured. No. Disease and disorder difference. Disorder is something that is there when we were born. No, all the answers are wrong. Chalo, disease and disorder we'll discuss here. Health we discussed. Health term we discussed. Now disease and disorder I'm going to explain. If I'm saying disease, okay, disease means anything in your body due to that you are not at ease. Ease means you're not relaxed. Due to any change you are not relaxed. Ease means relax. So when we are not relaxed, we are not feeling well due to anything, we are diseased. We are diseased. Disorder, when in our body things are not in order. Don't go to inherited, it is genetic, it is infectious. Don't go to that. Simple answer I'll give. This is disorder. This is when things are not in ease. When you are not feeling well, you are not easy, you are not feeling ease, then it is dis-ease. When things are not, your body parameters are not in order, it is disorder. Disorder. All diseases are disorder. I'll save the next, that all diseases are disorders. All diseases are disorder. All diseases are